Bacterial vaginosis. What to know? Bacterial vaginosis, also known as vaginal bacteriosis, is the most common cause of vaginal infection for women of childbearing age. It frequently develops after sexual intercourse with a new partner, and it is rare for a woman to have it if she has never had sexual intercourse. Bacterial vaginosis also increases the risk of developing a sexually transmitted infection or STI. However, bacterial vaginosis is not considered as considered an STI. Bacterial vaginosis is the vaginal infection most likely to affect women between the ages of 15 to 45 years. Symptoms. Bacterial vaginosis may be present without symptoms, but if symptoms occur, they include vaginal discharge, burning and itching. Vaginal discharge may be watery and thin, be grey or white in color, have a strong and unpleasant smell, often described as fishy. Less commonly, there may be a burning sensation during urination, itching around the outside of the vagina. Between 50 to 75% of women with bacterial vaginosis have no symptoms. Bacterial vaginosis alone is not considered harmful, but complications can arise. Causes. Bacterial vaginosis is caused by an imbalance of naturally occurring bacterial flora, the usual bacteria found in a woman's vagina. Why this happens is not clear. The role of bacteria. All parts of the body have bacteria, but some are beneficial while others are harmful. When there are too many harmful bacteria, problems can arise. The vagina contains mostly good bacteria and some harmful bacteria. Bacterial vaginosis occurs when the harmful bacteria grow in numbers. A vagina should contain bacteria called lactobacilli. These bacteria produce lactic acid, making the vagina slightly acidic. This prevents other bacteria from growing there. Lower levels of lactobacilli may cause the vagina to become less acidic. If the vagina is not as acidic as it should be, this can give other bacteria the chance to grow and thrive. However, exactly how these harmful bacteria are linked with bacterial vaginosis is not known. Risk factors. Any woman can develop bacterial vaginosis, but some behaviors or activities can increase the risk. This include douching or using water or a medicated solution to clean the vagina, having a bath with antiseptic liquids, having a new sex partner, having multiple sex partners, using perfumed bubble baths, vaginal deodorants and some scented soaps, smoking, washing underwear with strong detergents. Bacterial vaginosis cannot be caught from toilet seats, bedding, swimming pools or touching objects. Treatment. Bacterial vaginosis often clears up without treatment, but women with signs and symptoms should seek treatment to avoid complications. Treatment may not be needed if there are no symptoms. Sometimes bacterial vaginosis can appear and disappear for no apparent reason. If there is an abnormal vaginal discharge, it is important to see a doctor as soon as possible. A doctor can diagnose bacterial vaginosis and rule out other infections such as gonorrhea. Untreated bacterial vaginosis can also lead to complications, especially during pregnancy. Some doctors recommend giving bacterial vaginosis treatment to all women who will be undergoing a hysterectomy or termination before the procedure, regardless of symptoms. Male partners do not usually need treatment, but they can spread bacterial vaginosis between female sex partners. Prevention tips. There is no certain way to prevent bacterial vaginosis, as the exact causes remain unclear. However, some tips can help prevent it. This include practicing safe sex, not douching. The Centers for Disease Control and Prevention note that bacterial vaginosis rarely affects women who have never had sex.